So in this era of hepatocellular carcinoma management, where our patients now are having more than one option in both frontline and second line settings, in addition to the complexity of those patients with low tumor load who could also have some options related to local therapy upfront, the management has to be linked to a multidisciplinary approach upfront, looking at the tumor load and correlating that with the patient performance and nutritional status, liver function status. So if the patient is not a candidate for resection or transplant, next option should be local therapy approach based on the tumor load, and that should be followed by systemic therapy if the patients are not responding to localized therapies or didn't tolerate it well. For example, in a multidisciplinary setting, the decision would be made to start systemic therapy. Frontline and second line therapies are going to be dependent on the specific practice and specific level of comfort, also the patient's baseline in terms of their liver status and comorbidities, for example, uncontrolled hypertension or autoimmune disease, which would exclude immunotherapy options in routine practice or clinical trials. So again, this is a disease that needs to be managed by a multidisciplinary team of oncologists, hepatologists, our surgeons, intervention radiologists, in addition to our dietitian and supportive care team. So third line is going to come up because we have been managing our patients in a better way in the last few years. So patients, if they are managed appropriately and in a multidisciplinary manner, they could remain to be in good shape through front and second line therapy and could still be in Child-Pugh A candidates for clinical trials or even third line options. We don't have any evidence-based medicine yet in terms of which sequence to follow or which third line to pick and choose from. But in the next few years, we're going to have more data about this space. Who would have thought hepatocellular carcinoma patients will be going for third line 10 years ago when we didn't have anything other than one drug in frontline setting? So it's definitely an exciting time for our patients and also our treating physicians.